This is Dr. Carrie Holmes with the St. Cloud State Medical Clinic, and I wanted to talk to you about sleep problems, which are really common in college students. The most common thing we see is that students will delay their sleep time because they're studying, or they're on their phone, or they're on the computer, and then they have trouble getting up in the morning. Or if they do get up, they often take naps, or they're tired during the day. So it's important to set a consistent bedtime and consistent waking time. And if you do have trouble sleeping, wake up at the same time regardless, even if you're tired, and get some bright light, especially early in the morning, to help reset your sleep patterns. You can also take a small dose of melatonin in the evening to help you with sleep. And over several days, if you avoid napping, even if you're tired, you will eventually reset your sleep-wake cycle. Sometimes students will use stimulants such as coffee or caffeine products. They may also smoke or drink alcohol, and all of those can affect your ability to sleep in a negative way. The things that help your sleep are if you're exercising regularly, again, if you're consistent about your pattern, and if you try to do something that relaxes you right before you go to bed. If you have problems with anxiety or depression, you may also experience difficulty going to sleep or staying asleep. And then you really need to look at how to manage your stress. Talk to someone. We have counseling services upstairs that can help you manage your stress a little bit better, or come and see us if you think maybe you need additional help. Rarely we see patients who have sleep disorders like narcolepsy or periodic limb movements or restless legs or obstructive sleep apnea. These are all less common in students, but they require a more significant evaluation. You usually need to see a clinician to discuss those if you suspect you might have one of those sleep disorders. One important point is that if you are having trouble sleeping and you're laying in bed and you can't fall asleep, don't stay in bed. Get up, move around, get a drink, maybe have a light snack, read for a few minutes, and then try to go back to bed. It never helps to lay in bed and look at the ceiling for hours on end. The minimum we want you to stay in bed is at least 5 hours. You may be tired, but push through, don't nap, and eventually your sleep cycle will hopefully reset. And if it doesn't, come and talk to us. There are medications that we use to help with sleep onset and maintenance, but many times you can improve your symptoms on your own if you just follow some basic rules about sleep hygiene and avoid some of the common traps that we see students falling into. Thanks, and have a restful night tonight.